Yeah, so my job in this particular presentation is to demystify medical jargons. So actually, when you are in your last trimester, or maybe you have just conceived, there are a lot of medical words that are used by people around you and by doctors. So, and there is a lot of confusion as to what is what. So, let me just demystify those medical terminologies and make you comfortable, because when you're going to enter into the labor room or when you're going to go to your doctor for the checkups, certain things are going to come your way. The first thing is the visits. Like the first, as you conceive, it comes like how many times will I have to go to my doctor? So the first visit has to be done as early as possible, as soon as the um, the conception has happened. Ideally, it should be during the preconception. But if the preconception visit has not happened, so at the first diagnosis of pregnancy, please visit your doctor, because there would be certain investigations needed and workup has to be done depending on the need. The second visit, for the first 7 months, we normally advise visiting the doctor on a monthly basis. During the eighth month, it's going to be twice a month, meaning every 15 days. And in the last ninth month, it has to be a weekly visit to your doctor. So the weight gain again is a dilemma as to how much has to be gained in each trimester. First trimester, there is a rule of 1, 5, and 5, meaning the first trimester, in the first 3 months, you are supposed to put on 1 kg of weight, and at times, because of the excess vomiting, there may not be that 1 kg weight gain, and there could even be a fall in the weight. So you don't need to worry on that. In the second and in the third trimesters, it's going to be nearly 5 kgs. So an average, depending upon your pre-pregnancy weight, there is a weight gain of 11 to 17 kgs during the entire pregnancy. Now sonography, like when is the first sonography done is at the if there are if you're very comfortable with the pregnancy, then the first sonography would be done at around 6 weeks to determine that the pregnancy is normal, the fetal cardiac activity is okay. The second, how many, is another question. So how many is like the first sonography at 6 weeks. Next, second sonography at around 11 to 13 weeks, which is also called the NT-NB scan. NT is like the knuckle thickness, and the nasal bone scan. The third sonography, which is important, is the level 2 scan, which is done around 18 to 22 weeks. And the last sonography is the color Doppler, done between 34 to 36 weeks. There could be a need of getting the more sonographies in between these as per the need of the person, of the mother. Now, at times there is a confusion, like the sonography says that it is a breech or transverse. So till the 7 months of pregnancy, the presentation does not have too much of a significance. We start looking at the presentation after 7 months of pregnancy. So if your sonography before 7 months shows breeches, the buttocks down, transverse is the baby's neither the head is down nor the buttocks is down, it's lying in the transverse position. So, but these do not carry too much of a significance till 7 months of gestation. Now, another terminology is amniotic fluid index, or the AFI, so which is measured by seeing the 4 pockets of amniotic fluid and then summing them up, which gives you the amniotic fluid index. So if it is normal, it is normal. If it is excessive, the doctor is going to suggest you what needs to be done if it is excessive or if it is on the lesser side. The biophysical profile, it incorporates 5 things. This is also seen by ultrasound as per the need. So the movement of the baby, the tone of the baby, the amniotic fluid index, which I already addressed in the previous slide, the heart rate acceleration, and the breathing movement. These are all seen during the sonography, and a score is given on the biophysical profile. If it is 8 to 10, it is good. If it is less than that, the doctor is going to suggest you on what needs to be done. So daily fetal movement count, or the DFMC, this is it is concerned with the movements of the baby. So in the early trimester, say around the 17 to 20 weeks of gestation, it is just the initial flutter. What movements you see you feel is just like the gas moving in the abdomen. That is the initial flutter. Then after that, actually, you don't have to count the movements on a daily basis unless it is a high-risk pregnancy. Just that you have to be aware that, yes, the baby is moving and you are appreciating the movements. In high-risk conditions, we do advise tracking the number of movements, which is minimum has to be around 10 in 12 hours. So if that much movements are happening in the baby, then you have to assure yourself that things are all right. Now, one terminology is your doctor will tell you that you have to get an NST done or a CST done. So it is just similar to the ECG of an adult. Sorry. So ECG of the adult, it is done on a piece of paper where the heart rate variations and the accelerations are seen. So the electrode is connected on the abdomen, and NST is the non-stress test. This is done when the person is not in labor. And CST, the same test is done when the contractions are happening and the labor process is going on. So NST just shows us that everything is all right. The baby is receiving adequate oxygen and blood supply. CST also that the baby's heart rate is going all right with the contractions that are coming, because the contractions will come and go. And in that process, how the baby's heart rate variations happen is the CST, is the contraction stress test. Now coming to the onset of labor, how labor begins is, why I'm addressing this is, when you understand the physiology of how labor begins, it becomes easy. So as even holistically and medically, you see that the onset of labor basically starts with the fetus. So I always tell that when somebody asks me, I say, when somebody asks me as to when the delivery is going to happen, my first answer is whenever the baby will decide the delivery will happen. So holistically also, baby is very, very powerful. You need to understand. So the baby will orchestrate all the events, even in the spiritual realm. And also, if you see in the medical realm, it is the baby who determines when the onset of labor is going to happen. How the baby is determining is, you see here in this particular slide, the fetus comes first. So there are certain changes happening in the brain of the fetus. Certain hormones are being released in the brain of the fetus. These hormones, then they will go through the placenta, go and cause certain changes in the placenta. And because of certain hormonal changes in the placenta, there will be changes in the maternal in the mother, and in the mother this will go into the uterus, beginning to contract. So can you see and can you understand how powerful the baby is medically and spiritually? When you will go into the deeper knowledge of the spiritual, it is the baby is so powerful that all the events that are happening in the delivery process, and it is because now I do understand how the baby is so powerful. In fact, I have actually experienced this. I can, mentally request the baby to help me conduct certain events, and I have found myself succeeding in that. And maybe someday I'll share more of my experiences in this regard, but just to make you understand that how the onset of labor begins with the fetus. Now, coming to the labor pains, how do you realize that the labor pains or the pains that are happening are true labor pains or false labor pains? So the true labor pains, I will come to on the next slide, which will give you an idea. The false labor pains are when the pains they begin and they may mimic the true labor pains, but they're not associated with the changes in the uterus that happen with the true labor pains. So the false labor pains, they are called false because over the period of time, they will subside also. If some painkiller is given or some reassurance is given and without anything also, over the period of time, they are bound to subside. But the true labor pains, as you see in this particular slide, there is contractions or tightening of the uterus. Then there are period-like cramps. Small blood-stained discharge may be present per vagina. There is lower backache, which could be radiating to the thigh. There is an urge to go to the washroom. And a gush or trickle of water as the membranes leak. So all these are the symptoms that are connected with the labor pains. Now, if you see, contractions or tightening can happen even in the false labor pains. There could be period-like cramps in the false labor pains also, but there will not be any blood-stained discharge in the false labor pains. There will not be an urge to go to the toilet, and there will not be a gush or trickle of water as the membranes break. So this is, and the false labor pains will diminish over the period of time, while the true labor pains, they will keep on increasing and you will have to rush to the hospital after some time. As it is seen when you go to the physiology of the true labor pains, what's happening is, if you can see clearly from this picture that the uterus is contracting, this is the cervix. The uterus is here, the cervix is the mouth of the uterus, and this is the vagina. You can see there is a particular length of the cervix. When the uterus contracts during labor pains, this is, you can see that the cervix is shortening. Gradually, the cervix begins to merge with the uterus, and this is called effacement. So when the uterus is contracting, the baby is coming down, the cervix is merging with the uterus. So there is a shortening of the cervix, and this mouth of the cervix, then this will eventually dilate. You can see in this particular slide that it is dilating and it is aiding the downward descent of the baby. And then finally, the mother and baby, they coordinate and the baby delivers. So how do you distinguish the discharge that is happening per vagina? It could be either normal or it could be abnormal. So if you see during pregnancy, the normal discharge is a little thin or it could be mucoid, but it does not have any smell and it is not associated with itching. While abnormal discharge is normally associated with itching and it may have a little foul or fishy smell. So if that is the case, you have to report to your doctor and the doctor will give you a remedy to that. So, how do you see, how do you distinguish the discharge from the water break? So discharge, I've already told you, which could be a normal or an abnormal, which could be possible infection. And if there is the water breaking, so a lot of people, they confuse a little bit of mucus discharge or a little bit of watery discharge. There could be a little staining of the undergarment with the normal discharge. And how you differentiate from the water breaking is that when actually the membranes break down, then there is a pop in your belly, which is followed with a gush of fluid. So anytime when there is a gush of fluid, which is copious in amount, a lot of amount, and all your garments, the undergarment and maybe whatever salwar or whatever you're wearing, if that actually soils a lot, then that means it is the water which has broken. There could be feeling of warm water coming out each time you change position. So it is because it is leaking, and you have to constantly change your underwear, and there is a leakage that you cannot control. So because how you differentiate this from a urine leaking is, urine leakage you can always control, while the water breaking you cannot control. So again, coming to the preparation, as we have already seen in the earlier presentation, that you have to prepare your mind and your body for the process of labor. It is very, very important. Communicate with your baby. Communication, as I say, that the baby is very, very powerful, both medically and holistically. So communicate with your baby. The baby is going to help you a lot with the process of labor and delivery. Strengthen your body. And of course, you have to empower your mind, because eventually your mind is going to help your body and your baby to deliver. Select the mode of birthing. We're going to talk about this in the future slides and in the future sessions. So you have to select the mode of birthing and plan. Plan, plan, and plan. That is the dictum actually, because positive birthing experience goes lifelong, because whatever experience you're going to have at this time during the process of labor and delivery, this is going to be with you for the rest of your life. So as we plan for any journey, whenever we're going out, we do so much of planning. We plan for the tickets, the hotels, and everything. So now, and as the baby is going to grow, you're going to plan for the baby's education, the school, the books, and everything. So this is a very, very important phase of your life, and please plan it very, very well, so that at the last moment there is no confusion, there is no dilemma.